Hi guys, so today's topic that I want to clarify with you is all about Reiter's disease. Let's go, take your pens, papers, and I'll try to clarify these misunderstood questions that confused you on the big exams. So as the other questions of this ways, of this series, I suppose that will be mindful and useful not only for your big exams, but as well as for your future medical practice. So let's go on about Reiter's disease, the questions that confused you. So reactive arthritis and Reiter's disease is the same thing, my beloveds. So in some periodics you can find Reiter's disease. No, actually it's a question of, we can say question of tradition. So we use this definition, this hemisphere, Reiter's disease, well as in Western hemisphere, maybe reactive arthritis. Actually doesn't matter. Reiter's disease, also known as a reactive arthritis, it's a seronegative spondyloarthropathy. Okay, so Reiter's disease and reactive arthritis, the same thing, and are both, so it's the same thing. It's a seronegative spondyloarthropathy. Spondyloarthropathy, characterized by the classic triad of arthritis, urethritis, and conjunctivitis. So classic signs are three, so-called triad: arthritis, urethritis, and conjunctivitis. So much, guy? Got it? Okay. Next point. About infection. Yes, my beloveds, triggered by infections. So Reiter's disease, let it be reactive arthritis, up to you. Reiter's disease often follows infection. So actually it's I think the better is pronounced triggers, not provoked, no, it's the same thing, but triggered by infections. What type of infections? Actually, good question. But we suppose it's a Chlamydia, trachomatis, genitourinary infections, Chlamydia, trachomatis, or enteric pathogens like Shigella, Salmonella, Yersinia, or Campylobacter. But anyway, Campylobacter, ancient name. Anyway, Chlamydia, trachomatis is the answer. So which infection provoke? If you remember, Chlamydia, trachomatis, largely sufficient. What is clinical issue of that? Taking a detailed history of recent infections, including diarrhea, urethritis, is crucial when evaluating patients with joint pain. Then, about famous HLA B27. About 60 up to 80%, it depends on source. Anyway, up to 80% of patients with Reiter's disease, reactive arthritis, carry this HLA B27 gene, making a significant but not absolute genetic marker, of course. What does it mean? What is clinical issue of that? Testing for HLA B27 can help support the diagnosis, my beloveds, especially in atypical or chronic cases. Okay? Next, classic triad. So I repeat, Reiter's disease is classically of course, described by this triad: arthritis, asymmetric, oligoarticular, predominantly it's like lower limbs, predominantly lower limbs, no legs, urethritis, non-gonococcal, and conjunctivitis or uveitis. So clinical issue of that, recognizing this triad helps promptly early diagnose and appropriate management. So arthritis, urethritis, conjunctivitis. AUC, up to you how to remember. Then, famous mnemonic capture: can see, can pee, can climb a tree. Can see, can pee, can climb a tree. So I propose you this mnemonic capture, that is, can see, conjunctivitis, can pee, urethritis, and arthritis, can't climb a tree. So I give you this popular mnemotic captcha. Can see, can pee, can climb a tree. Oh. So the catchy phrase helps remember to the core clinical features during exam and practice. Can see, can pee, can climb a tree. Then about keratoderma and skin manifestation. So-called keratoderma blenorrhagicum as a skin manifestation. The hyperkeratotic rash, often on the palms and soles, is highly characteristic of Reiter's disease. What is clinical issue of that? Identifying keratoderma blenorrhagicum, keratoderma blenorrhagicum, yeah, of course, blenorrhagicum, can provide a clinical clue in diagnosing the condition. Mucosal involvement, circinate, I don't know how to pronounce, circinate, circinate balanitis, no, actually in Greece, circinate, circinate balanitis manifests as a painless ulcers on the glans penis, seen in some, of course, male patients. What is clinical issue? So a genetical exam is essential in patients with suspected reactive arthritis to detect subtle mucosal lesions. About non-steroid anti-inflammatory drugs, first-line therapy are there. There are. So NSAIDs are first-line therapy, definitely. Non-steroid or anti-inflammatory drugs are a mainstay of treatment to reduce pain and inflammation. What is clinical importance? That starting NSAIDs early helps starting NSAIDs early helps alleviate symptoms and improve mobility. So about DMARDs, very fashion now. You answer in this manner. So in chronic or severe cases, DMARDs, so disease-modifying anti-rheumatic drugs, very fashionable. Anyway, so these drugs, DMARDs, like methotrexate, sulfasalazine, I don't know to pronounce, may be required. So these drugs are crucial when NSAIDs where NSAIDs. So DMARDs are crucial where NSAIDs alone are insufficient, especially for persistent enteritis. About enthesitis and dactylitis. Yes, both are common, and enthesitis and dactylitis. Inflammation as the site of tendon insertion, enthesitis, and sausage digitis, dactylitis, are commonly seen. Yes, sausage digits, dactylitis. Clinical issue of that documenting enthesitis and dactylitis helps differentiate reactive arthritis, Reiter's disease, from other seronegative spondyloarthritis. What is prognosis and chronicity? Prognosis and chronicity. While most cases resolve within 6 up to 12 months, around 1/5, 20% of patients develop chronic or recurrent arthritis. So, clinical issue, long-term follow-up may be necessary, especially with persistent symptoms or those requiring immunosuppressive therapy. No, that's all. That's all questions that confused you on exams. Thanks. I hope it was helpful for you, my beloveds. God bless you. Thanks for your attention. Don't forget to follow and subscribe my Dr. Y YouTube channel, as well as my Telegram channel, Dr. Y. So of course it's a private, and it's a Telegram. So how to subscribe my private channel, Dr. Y, in Telegram? Easy peasy. You tap in searching mode in Telegram, Dr. Y, W-H-Y, like question, why? So next, it's a bot. You click start and you choose your plan. It's not costly at all, very cheapy. And then we will see, we will talk You will find a lot of questions like these, MCQ questions, answers, explanations, explications, students' cheat sheets, why not? A lot of presents, gifts, but you have to subscribe. God bless you.